Hi, Dr. Kim. Are you ready for your potential patients to get to know you a little better today?
Absolutely. Let's dive right in.
Dr. Kim, you were born in Philadelphia and raised in South Jersey. How has your upbringing shaped your approach to your medical career and your interactions with patients?
That's a really interesting question. As far as my medical career, I have I guess a fairly typical or stereotypical really path. My father was a radiologist, so when I first started college, I was like, no way am I doing medicine. And then I tried a couple things freshman year and I was like, oh, I guess I'm doing medicine. How it's actually shaped my treatment of patients and my overall just gestalt of medicine in general, though, is my father has Parkinson's now, fairly advanced Parkinson's, and I've kind of been on both ends of the medical spectrum, both as a patient advocate and a physician. And so that's what's really shaped my desire to really have a multidisciplinary group like we do, to be able to treat the patient as kind of a unit, as almost kind of being able to guide the patient without having them get lost in the sea of medical advice and specialists.
What inspired you to pursue a career in medicine, specifically in the field of interventional radiology? And how does that passion influence the care you provide to your patients?
Well, medicine radiology was definitely inspired by my father, but as far as interventional radiology goes, as a first-year resident in diagnostic radiology, there's a very heavy focus on the reading room. You know, you're getting through a lot of information at one time, trying to adapt yourself to a totally different setting compared to where you were for 4 years in medical school. I thought I wanted to do a couple things as it relates to diagnostic radiology, and I really just missed a lot of the patient interaction, that comes with having to get through many studies of very, of large importance. But I just needed that patient interaction again, and that's when I kind of stumbled upon interventional radiology as a second-year resident, where you could take both what you learned as far as diagnostic radiology and interpreting images and apply it kind of more physically in kind of constant interaction with patients and moving about a little more.
Duke University, Jefferson Medical College, Albert Einstein Medical Center, and the University of Virginia each played a pivotal role in your education. What were some of the key moments or experiences from these institutions that influenced your career path and your approach to patient care?
Well, I can definitely say that college was when I realized I certainly didn't like some fields, and that pushed me towards medicine. I think the biggest influences on my development as an interventional radiologist definitely came during residency and fellowship. I was one of the last few years of the diagnostic radiology residency and then a typical 1-year interventional radiology fellowship. These days, it's kind of a combined pathway where interventional radiology is its own separate kind of unit that goes through everything. But I was in a residency that had a lot of freedom. We had a lot of independent kind of work where if you got things done, you were rewarded with kind of more freedom to figure things out for yourself. That extended to fellowship, where I learned kind of under the same paradigm, and it really gives you a solid foundation with the kind of realizing that the procedures from a technical standpoint are relatively straightforward. You know, there's not much variance from day to day as far as you need these crazy expertise or you need some magical hands or something like that. The real treatment the real realization for me was that figuring out when to actually intervene or when to actually do a procedure in what patient, kind of figuring out what was best for the patient was the real learning experience all through residency and fellowship.
What do you enjoy most about living and working in South Jersey? And how does being part of this community affect your connection with and approach to treating patients?
Well, growing up in South Jersey, I've always wanted to come back. My parents still live here. My sister is in Philadelphia now. My brother is in Haddonfield. So we're all around South Jersey. I grew up in South Jersey. And it's interesting because I believe Philadelphia has one of the highest combined concentrations of medical staff probably in the country. but we're in a we have a relative dearth of high-level practitioners in the eastern South Jersey area. So I love that our group is so multidisciplinary, and we bring the highest level, both interventional and open vascular care available that rivals, what you would receive or what you would hear about at the major teaching institutions.
Outside of your work in interventional radiology, what are some of the personal interests or hobbies that help you unwind? And do they influence how you connect with your patients?
Well, right now my only hobby is my 4-month-old son. So I think all hobbies have been put on the back burner for now. But I like, well, the biggest thing probably is guitar. It's the easiest thing to unwind, and there's some component of dexterity, associated with playing a musical instrument and then doing a lot of things with your hands. I always tell myself, there was actually a medical study published saying that people that play video games a lot end up being better surgeons. So I'm going to stick with that because I definitely played a lot of video games growing up. But those are the two things that currently are at the top of the list.
Could you describe your approach to treating your patients, especially when it comes to explaining their treatment options and ensuring they feel informed and confident in their care?
Well, I think what you mentioned is the most important thing. I think in this day and age, having the patient understand all the potential treatment options, including, not doing anything and optimizing their care as best they can from a life, whether it's lifestyle or habit changes, is the best thing for the patient. The treatment options are certainly there. We essentially offer and have available every potential treatment option, but only the individual can decide if that's going to be the right thing for them. We can certainly present them the information, the studies, what would we think would be the best option for them, but ultimately having an informed patient is going to be kind of the best overall approach to treatment in medicine these days. I'm Dr. Christopher Kim. Thank you for watching our video today. And if you have any further questions, please visit us at vi-ami.com.